When it comes to a hip replacement, you are the consumer and the surgeon is the service provider. How do you separate the master craftsman and craftswomen from the salespeople? Today, we're looking at how to shop around for an ethical, top-tier orthopedic surgeon and the critical questions that you must ask before entering the operating room. Choosing the right hip surgeon is a major decision. You are shopping for a qualified, ethical expert to perform a life-changing operation to ensure you get the absolute best care. Approach your surgical search like a smart consumer interviewing a high-stakes professional. Welcome to From the Hip. I'm Tiffany Anderson. I'm the health educator who became the patient. After multiple surgeries and years of recovery, I've learned that there is life after joint replacement. Each week, we'll answer one question that I wish someone had answered for me. In last week's episode, we talked about a lot of the feelings that can come up when you first learn that you need a hip replacement. And I offered some ways that you could become a more proactive patient by addressing those fears, understanding that you might be in a state of shock, and making a plan. Today, we're talking about your surgeon. And besides yourself, the surgeon is the most important person on the medical team. As you are choosing, choose carefully if you can, if you have options available to you. And some people do not, based on your location, your insurance company, and perhaps even the facilities nearby. I'm encouraging you to know your surgeon. You want someone who is credible, ethical, and has integrity. In the U.S., we have a medical marketplace, and that means it's a very competitive market. Did you realize that every state has a medical board where you can go and actually research orthopedic surgeons and know if there have been any disciplinary actions or any malpractice? Other places that you can research and learn more about your surgeon is simply by going to your insurance company website. They often have patient testimonials. A surgeon will also have a website, and that's another place where they can showcase their resume. You are interviewing someone who's going to basically have your life in their hands, and it's very proactive and very rewarding and gives you a better sense of control at a very frightening time when you're taking the initiative to really know the person that you want to work with. And if you have options, review each of those options. Many times I've talked to patients who feel intimidated, and yes, a surgeon, any medical professional, they have a lot of experience, they have a lot of education, though they are still, as I mentioned in the intro, they are the service provider. And as the patient, you are the consumer. And that means it's incredibly important for you to do your research. In my mind, a doctor who truly wants your business is someone who will want to reassure you, impress you, and ultimately earn your business. It's okay to walk into a medical appointment or to even call a doctor's office and actually ask for backgrounds, ask for testimonials, ask for the amount of surgeries that they have performed. Were they all successful? And those that weren't, what happened? What did they learn? You might be surprised when you find that the majority of healthcare providers are often quite flattered if they find out that you've been doing your research well ahead of your appointment and you know where they went to college, what type of credentials that they have, because they've invested a lot of time and effort and they know that they have a lot of influence on your health. A proactive patient that has done their research in the early stages of preparing for joint replacement, you're letting your surgeon know that you are motivated, that you are willing to put in the effort, and that makes their job easier. That level of engagement between patient and healthcare provider is refreshing because it honestly doesn't happen enough. And let me repeat again. During this process, when you are shopping around, when you are meeting your orthopedic surgeon, you're looking for a qualified, ethical expert because they're going to be performing a life-changing procedure. Let's talk about those critical questions that you're going to take with you to every medical appointment, especially in the early days, and ensuring that that's the right orthopedic surgeon for you. I'm going to give you 3 critical questions that were essential while I was preparing for joint replacement surgery, and an extra question that I had missed. And had I prepared for that initially, I believe it would have saved me a lot of time, a lot of heartache, and a lot of pain. The first question is about the placement. This will come in the early stages when they're actually assessing your body, the actual damage inside, and then what type of a candidate you are, as well as the abilities of your surgeon. There's posterior, which is in the back, or an anterior placement. They're both very different, and they change the way you feel. They will change the way you recover, and there's different precautions for each surgery. And as a reminder, I am a health educator, not a clinician. This is not medical advice. I am a health educator, a wellness coach, and a patient advocate. Let me show you what I mean by posterior or anterior. This model of a hip joint should give you a better idea of the placement, whether it's anterior or whether you're going to be receiving a posterior placement. The posterior placement is considered traditional and the most common approach. A posterior approach cuts through the buttocks to access the hips along the back side here, and it requires a longer recovery time. Plus, the patients are at a higher risk for dislocation afterward. And the anterior approach along the front of the body is less invasive and allows the surgeon to move the muscles rather than cut through them. Though the anterior placement, it isn't appropriate for some patients. It requires special surgical equipment, and only certain surgeons are trained in this procedure. Depending on your situation, this decision will affect your recovery, plus how well you'll be able to move long after you heal. Learning all that you can about the type of placement of your hip replacement is crucial, especially as you move through your recovery, plan for the days ahead, as well as consider any lifestyle changes and in the future if there might be a revision necessary, because that will make a difference as well. The second question is all about rehabilitation, and if you're going to be actually cared for at home right after you leave the hospital, or if it would be better for you to transfer to a rehab facility. That's a very important question. Some people put this off until right after surgery or right before surgery, though preparing for this well ahead of time can save you a lot of time and save you a lot of money. You'll of course want to check with your insurance company because they may or may not pay for the rehab facilities, which can be very expensive. This is an important topic to discuss with your caregivers, and one that I missed and regret. Having the rehabilitation facility gives you a better sense of security, and if you have that option available to you, it may be worth investigating, visiting, taking a tour, and talking to the physical therapist, the physician's assistant, and seeing if that would be a better situation for you, knowing that the caregiving aspect can sometimes be really overwhelming, and it might be more than those that you love are able to take on. The third critical question is a very delicate and personal subject, and this is asking your surgeon about your weight and how it may impact the surgery and your ability to recover after surgery. This is a topic that some surgeons will not approach, and if they do, they're very tentative. Having excess weight on your body can actually add unnecessary pressure on your joints. When your joints are healthy, this is a negative. When your joints are compromised, especially if you are a candidate for joint replacement, then that excess weight is putting undue pressure on your joints. When you have surgery, that's going to create an inflammatory response because it's a state of trauma. That's what surgery does, and so there will be an extreme amount of swelling. Many surgeons will actually ask their patients if they can put off the surgery, then suggest that they take some time to drop anywhere from 10, 20, 30 or pounds or more. That may or may not be your situation, and again, it's very personal, one to talk to your surgeon about. When I met with my surgeon, and it was in the post-op stage, and when I asked, what could I do to best take care of my artificial joints once I had them? And the one thing that he said to me is that to do my best to keep my weight down. Because did you know that 5 pounds of excess weight, just 5 pounds, can put up to 25 pounds of pressure on your joints? That's dangerous to a healthy joint, and it can be deadly and detrimental to an artificial joint. And when you're entering surgery, do your best to make yourself the healthiest candidate possible. Now, that's not always available. There are emergencies. Sometimes people need to go into surgery right away because there's been an accident or there's no more waiting. Do your best. The additional question that I referenced early on has to do with the caregivers and rehabilitation. It wasn't an option available to me. As much as my loved ones felt that they could truly be there for me, when the reality set in, and because of everything that was going on with my health at the time, it was overwhelming, and they weren't prepared. I wasn't prepared, and it took a toll on all of us, and some relationships were damaged. That's where, early on, having your caregivers go with you to your doctor's appointments, have those candid, challenging, difficult, painful conversations with the doctor and certainly at home, because all of that is going to be crucial for you to have an accelerated and successful surgery and the healing process during your recovery time. I'm going to give you a gift, and it's a free PDF of questions to take to your doctor, including those that we discussed today. Look down in the description. The PDF is linked below. Step by step throughout this series, I want to help you better understand your medical team so that you can better prepare for surgery. And as I mentioned, have an accelerated recovery time. I hope this information was useful, and the suggestions that I provide help you along your journey into this next chapter of your life. What question should we answer in the next episode of From the Hip? Leave it below. If you're preparing for surgery, recovering, or caring for someone who is, subscribe and join us next week. Thank you so much for watching.